Welcome to our series on living life with multiple system atrophy, or MSA. This presentation has been made by the healthcare specialists at the Multiple System Atrophy Trust, which covers the UK and Ireland. My name is Katie and I am one of the MSA healthcare specialists at the Multiple System Atrophy Trust. This presentation will explain what blood pressure is, describe some of the blood pressure issues experienced by people with MSA and the ways these can be managed. During the webinar, I will talk through how to monitor your blood pressure, or BP, and how the body regulates blood pressure. I will then explain why BP can be problematic when you have MSA and what postural orthostatic hypotension is. Practical management and medications to improve low BP will be discussed, as well as first aid measures. I will finish with some suggestions for managing BP when it varies from high to low over a 24-hour period. So what do the blood pressure readings tell us? BP readings tell us the force the heart uses to pump blood all around the body. I will now explain the key points for measuring your BP. They are important to ensure an accurate and reliable reading of the blood pressure. The cuff should be fastened around the upper arm. The width of the cuff should be the largest that will fit between the elbow and armpit, and no smaller than 2/3 this distance. The length of the cuff should wrap around the arm and fasten comfortably so that when the cuff inflates, it does not come undone. The arm with the cuff on should be rested and supported so the cuff sits level with the heart. Try and take 3 consecutive readings to get the most accurate results. When taking a BP recording, always use a machine that has been validated. This means it has been checked to record accurately. Machines should be rechecked at least every 2 years. The British Blood Pressure Association has a list of validated makes. It may be wise to keep a written record of your readings. These can then be taken to clinic to help decide the best treatment if you are symptomatic with blood pressure issues. When a blood pressure reading is taken, 2 numbers are recorded and written as one number over the other. For example, 120/80 millimeters of mercury. The first number is the pressure put on the arteries when the heart beats, that is contracting. This is the systolic reading. In the example, this is 120. The second number is the pressure in the arteries when the heart is resting between beats. This is the diastolic reading. In the example, this is 80. BP readings vary depending on the time of day and the activities we have been doing before the reading is taken. For example, it may be higher just after exercising or lower just after eating. BP readings tend to be higher as we age if we eat a lot of processed foods with added sugar and salt, are overweight, have excessive alcohol consumption, or lead persistently stressful lives. The accepted normal range is to have a reading of 90 to 140 for the top number and 60 to 90 for the bottom number. If someone has readings consistently above these normal levels, then they are considered to be hypertensive and require medication to help keep the blood pressure in the normal range. Often people do not have symptoms and are unaware of being hypertensive until a blood pressure check is done. The sort of symptoms that can be caused by high blood pressure are headaches, blurred vision, nosebleeds, and shortness of breath. If someone has persistently low blood pressure, called hypotensive, they too can experience headaches and blurred vision, and may experience muscle aches and feelings as though they are going to faint. The autonomic system in the brainstem detects whether all the systems in the body are functioning comfortably as they should. If it is detected that some areas of the body need more blood supply, increased production of hormones, particularly those produced in the kidneys, adrenaline and renin, are released to make the heart pump harder and change the elasticity of the blood vessels. Having MSA means that there is a shrinkage of brain cells in 3 key areas: the basal ganglia, which presents as Parkinson's symptoms, the brainstem, which affects the autonomic symptoms, and the cerebellum, which presents as ataxia symptoms. The autonomic nervous system is centered in the brainstem, So shrinkage of brain cells here can cause problems with regulating blood pressure, along with other bodily functions that occur without us consciously thinking about them. Over time, 70% of people with MSA will develop symptoms of low blood pressure, particularly in the daytime or when up and about. However, often people will also have high blood pressure whenever they lie down. This is called supine hypertension. We will talk more about this later. The autonomic nervous system detects the position and activity of the body to determine the amount of blood flow and pressure required at the time. Hormone release increases or decreases the heart rate and blood pressure by narrowing or widening the blood vessels. So, for example, every time we stand up, the arteries are narrowed to boost blood pressure and stop us fainting. In MSA, this adjustment to changes of position can fail or be delayed, causing what is called postural orthostatic hypotension, or POH for short. The symptoms of POH usually occur at the time of position change, such as moving from lying to standing, and cause a feeling of lightheaded or dizziness, blurred vision, confusion, nausea, and weakness. Prolonged spells of lower than ideal blood pressure, rather than a sudden drop when you change position, may cause achy pains in the larger muscles that need a good blood supply. For example, the coat hanger pain across the neck and shoulders, or low back pain or aches in the muscles at the top of your arms and legs. If these pains, particularly the coat hanger pain, are eased by lying down, this is a good indication that the cause is due to low blood pressure. Low blood pressure can also make you feel persistently tired and weak. Anyone with MSA should ideally have their BP recorded after lying down for 5 minutes and then after 1 and 3 minutes of standing. If you're not able to stand, then a lying to sitting recording is still valuable. And in clinic, they may only do a lying or sitting BP if you are unable to stand. If there is a drop in the systolic reading, the top number of 20, or in the diastolic reading, the bottom number of 10 or more, then recording the standing BP over a longer time intervals and noting if there is any change in the heart rate will indicate if this drop in BP is due to autonomic changes or purely a postural drop. A consistent systolic reading of 90 millimeters of mercury or less is also classified as significant and requires treatment. Persistent low blood pressure can be a cause of fatigue, poor concentration, muscle aches, and confusion or woolly headedness. Your GP or specialist can organise a 24-hour BP recording, which can be done wearing a monitor whilst at home. There are periods in the day when the BP is higher and at other times when the BP is low. This 24-hour recording can help fine-tune the treatment if required. Some clinics may do a tilt test where the person is secured to a bed that gradually alters the amount of upright tilt whilst BP and heart rates are recorded. Other tests that may be done in specialist centres are the Valsalva test, which requires someone to breathe out against a pressure resistance, and the cold pressor test, which can pick up the blood pressure response to stress. POH occurs when getting up from lying down or moving from sitting to standing. POH may also happen if someone stands in the same position for a long period of time. For some people, it can occur after eating when the blood supply is drawn to the gut to assist digestion. Straining to open the bowels can trigger episodes, as can sitting for long periods in direct sunshine or hot rooms. Not drinking enough is a common cause of fainting, so if you have MSA, it is important to keep well hydrated. There are also a number of practical measures you can adopt to counter these issues. Drinking at least 2 litres of fluid a day, particularly water, as this is quickly absorbed. Having extra salt on food, as long as you don't have periods of high blood pressure. This also helps keep the fluid in the bloodstream. Eating smaller, regular, low carbohydrate meals rather than one large meal in the day reduces the digestion time and the demand on blood flow if low blood pressure after meals is a problem. It is better to take laxatives regularly to avoid the need to strain on the toilet. When changing position, it is wise to take your time and be mindful after standing. Wait and let any lightheadedness pass before moving away from your chair or bed. Rise to sitting from lying gradually, using a bed head raiser or the riser function on a recliner chair. When moving from sitting to standing, do some leg exercises and have a drink if possible before standing. Once standing up, stay by the chair and allow time for adjustment of the blood pressure before setting off. Sit back down if you feel too lightheaded. Whilst you are sitting, do intermittent leg and arm exercises and avoid prolonged standing. While standing, tighten the buttocks, calf muscles and step from foot to foot. Exposure to heat can divert blood to the peripheral blood vessels, which can trigger a drop in blood pressure. So avoid spending too long in hot environments or taking too hot showers or baths. Pressure stockings or an abdominal binder can help maintain blood pressure by reducing blood pooling in the abdomen and the lower limbs. Being anemic or low in vitamin B12 can also lower blood pressure, so it is worth having a simple blood test to check these levels. All this information is on our postural hypotension fact sheet on our website or can be posted to you. There are a number of things to think about when considering medication management of low blood pressure. All of these require discussion with your GP or consultant. The first thing to think about is whether any medications that you may be taking for other health problems or other symptoms of your MSA are possibly making your low blood pressure worse. For example, Parkinson's medications or medications for erectile dysfunction. Many other medications can cause a drop in blood pressure. Sometimes it is possible to stop these medications or change to one that is less likely to lower blood pressure. Many people over the age of 50 are on medication to treat hypertension. If you are on medication previously to reduce high blood pressure and now experience symptoms of low blood pressure, then discuss this with your GP to see if this medication can be modified or possibly even stopped. Midodrine is often the initial medication tried to improve low blood pressure. This tends to be taken 3 times a day and no later than 4 hours before your usual bedtime. Fludrocortisone may be prescribed as a once or twice a day medication. This is a longer acting drug, so should not be taken after 2 p.m. or it may continue to raise your blood pressure once in bed. Other medications may be tried if midodrine and or fludrocortisone have not reduced the amount and effect of blood pressure drops. For example, pyridostigmine or droxidopa. If you have POH, you will begin to recognize the signs and can take remedial action. Everyone with MSA should always have a bottle of water with them to drink if they begin to feel lightheaded. If you actually pass out, this will bring you onto the floor and you are likely to recover and come round. Sit up gradually and drink your water, and then when you can, call for help and get somewhere safe or home to recuperate fully. If you are in a public place and you faint, hopefully someone will place a cushion or rolled up coat under your head and elevate your legs till you come round. This should happen within a couple of minutes. If it does not, then they should place you in the recovery position, call 999 and stay with you. In the first instance, if you feel your blood pressure dropping, move your leg muscles and drink some water. If you feel faint, ideally lie down, but if not possible, then at least sit down with your legs out, level with your hips and lower your head as much as possible. As soon as you feel able, or with assistance, sit up, have a further drink of water and get yourself home or to somewhere where you can lie down to fully recover. A variation in blood pressure between day and nighttime is normal, but it should be relatively small. Usually when lying down, the blood pressure should stay about the same or just reduce a little. If after lying down for 5 minutes, the blood pressure reading is 140/90 or higher, then this is called supine lying hypertension. If this is the case, then a short-acting medication may be needed to lower your blood pressure overnight. Other medication you take before bed, for example, some antidepressants, can also increase blood pressure, so these should be reviewed if at all possible. A 24-hour BP recording can be helpful in determining how much of a problem the overnight high blood pressure is and work out the best way to manage the fluctuations. We previously mentioned a number of things that can lower your blood pressure. These same things can actually be helpful to reduce blood pressure overnight. For example, drinking less after 6 p.m. or a small amount of alcohol just before bed, and a small meal or snack in the evening may all help reduce the rise in blood pressure when lying down. If overnight blood pressure is not too elevated, it is usually suggested sleeping at a 30-degree head elevation to help reduce the degree of drop in blood pressure experienced when getting out of bed to move around. However, if the overnight blood pressure is high, then it may be better to sleep lying flat in bed, as this reduces the effort and thus the pressure required to get blood to the brain. Elevating the head of the bed before getting up in the morning will help adjustment of the blood pressure for moving around. If you are taking medication to boost blood pressure in the day, then avoid lying down during the day to rest, as this may elevate the blood pressure too much. Instead, take rest sitting up or semi-reclined, for example, in a riser recliner chair. If you are taking fludrocortisone, then this should be taken no later than 2 p.m. to avoid blood pressure boost overnight. The key messages from this webinar are: everyone with MSA should get regular blood pressure recordings done at their neurology or movement disorder clinic. It may be useful to get a home blood pressure monitor so you can check your blood pressure regularly and when you feel you have symptoms of low blood pressure. If you experience symptoms of low blood pressure, try to identify if there are any triggers and avoid these. Put into practice the practical management strategies that have been discussed in this webinar. Inform your GP and consultant if you have symptoms of low blood pressure, allowing them to consider if medications need reviewing, further tests need doing, or a medication that should be started specifically to boost your blood pressure. The MSA Trust support those living with MSA, their carers, family and friends by providing an MSA healthcare specialist telephone and email support service, Monday to Friday, 9 a.m. to 5 p.m. You can find the specialist for your area on our website. Our social welfare specialists can give you information about financial help, including grants for adaptations and equipment. They can also talk to you about how to access care and support and other non-medical issues you may have. We provide information materials and fact sheets about living with MSA and symptom control, all of which are available on our website. We run a network of support groups located around the UK and Ireland with help from our volunteers, and also run digital support group meetings. We oversee a supportive online forum on Health Unlocked. We give support with communication aids and voice banking. We provide accurate and up-to-date information through MSA News, our regular magazine, and through our website. We offer education sessions and have specialist guides for health and care professionals working with people living with MSA. The MSA Trust is funded entirely by voluntary donations, and all our services to people affected by MSA are completely free of charge. Our contact details are on your screen now. Thank you for listening today, and please do get in touch with us if you have any questions. This presentation contains basic information and is not a substitute for medical advice from your specialist.